Hi, I'm Dr. Ivan Puah, and I founded Amaris B clinic in 2004. I'm an accredited liposuction doctor and medical aesthetics doctor based in Singapore. I've been trained directly under Dr. Alfredo Hoyos and Dr. John Millard for visceral liposuction, and Dr. Pierre Fournier for liposculpture, fat grafting, and thread lift, and also under Dr. Delgado for dedicated surgical training in gynecomastia surgery in San Francisco. Okay, one of the most common questions or requests that I often hear nowadays is removal of buccal fat, PAT, which is like buccal fat surgery. This allows the patients to look slimmer, chiseled cheeks, especially for those who feel that they have round, puffy faces or they look fat. So what I would like to discuss today is the importance of buccal fat and why I would advise patients to think carefully about doing this procedure. Well, buccal fat is a layer of deep fat within your cheeks that kind of support your facial structures and provide your facial definition. Well, it fills the deep space tissues, acts as a gliding pad when your masticatory and muscles chew and contract. So for patients who have undergone or who are thinking of going through buccal fat removal, the surgery basically is done through a cut inside your oral cavity and to reach out to the fat pad and remove it. So it is not through liposuction or not through any other means. So after removal of the fat pads, the face will look a little bit hollow and a little bit flatter and slimmer as well. And this is the objective of doctors and patients, let them achieve more chisel and slimmer look. Now, however, what we'd like to mention is that buccal fat is actually a crucial part of your facial fat distribution, and it supports your face. As you age, your fat actually atrophied. So what could go wrong for buccal fat removal surgery? First of all, surgery is done through oral cavity, cutting through layers of your buccal mucosa. There's a possibility of a nerve damage, first of all. And secondly, that if there's uneven volume of fat being removed, then the facial asymmetry may occur as well. Next is that too little or too much fat being removed will lead to unsatisfactory results or asymmetry. Okay, lastly, buccal fat is important to help maintain the youthfulness of his face. Without buccal fat, for patients who's above 30 years old, they will usually look a little bit more hollow, saggy, and more aged. So I'll usually advise patients not to remove buccal fat because they may feel that they are bothered with puffiness or fatty cheeks when they are young in their 20s. However, without that, they often will regret it and will require correction procedures or treatments to fill up the volume loss when they are 30s and beyond. Well, nowadays, there are many ways for us to help patients slim down, ranging from injectables, energy treatment devices, liposuction of cheeks, jowls, and so on and so forth. These treatment and alternatives not only allow us to help patients achieve their objective, like slimmer, lifted, and sculpted look, but we also reduce the risk for hollowing out their facial features, make them look older than they should be when compared to buccal fat removal surgery. In summary, I would advise patients to consider alternative treatments I mentioned earlier on. This allows them to achieve a more lifted and chiseled look without the risks and complications which buccal fat removal surgery brings, which is hollowing, sagginess, and changing of your facial profile. Because the complications from oral fat removal surgery, it's permanent and irreversible. Thank you for listening. If you have any questions, just email us. See you again.